Hello, everyone. Welcome to week 7, the final week of our semester. Congratulations for making it all the way through. It has been so much fun, and I've really enjoyed engaging with you all through this semester. This week, we're going to look at the conjoined child-parent-caregiver session, and we're going to kind of try to wrap things up nice and neatly this week also. So we're once again going to review our flow of intervention, right? We have assessment, which is what? Ongoing. It's always happening. In this assessment, we're looking at safety, right? Does the client feel safe within our environment? Does the client feel safe with us? And we are building the therapeutic relationship, which also is always ongoing. And we're building that therapeutic relationship for who? For whose sense of safety? Mainly our clients, right? And then we get into the stages of TFCBT. And we talked about the first stage of parent caregiving and psychoeducation and parenting skills, also ongoing, right? It happens every session. We look at relaxation skills for the client, and this is important because it's going to help them to engage their prefrontal cortex when their amygdala is taking over that fight, flight, or freeze response that it tends to do when it's triggered by trauma reminders. We also look at the affect expression and coping skills for emotions. We talk about cognitive coping part 1, right? That cognitive reprocessing, that rewiring of the brain, of the neurological maps. The trauma narrative, which can be difficult and challenging, but it is imperative that it occurs because it's a verbalization, it's an externalization of those trauma experiences, and it helps to process the trauma and to integrate it into different parts of the brain so that's stored differently in our client's memory. And then we have cognitive processing part 2, which is where we look at the cognitive distortions that we were able to identify during the trauma narrative, and we can address those cognitive distortions down in that. Now, the last part of TFCBT is the conjoint session, and we also have safety, which will be put into here. So the conjoint session, it comes after, okay, after the child has processed their narrative in individual sessions with the clinician, with you. So if a joint session were to happen before they do this with you, then the focus should be on just general topics of discussion. So just educating the parent or the caregiver about the event and giving some enhanced parent-child time, like playing games, drawing together, building that relationship. And this also can count as in vivo exercises. What does in vivo mean? In life. So it's that exposure to the trauma. So the format of the joint session, it's suggested that you have 15, 15, and 30. So that's 15 for each individual client that you work with. You talk to them for 15 minutes, then you bring them together for 30 minutes, and then you work with the client again for 15 minutes. So what is the goal of the joint session? Well, the goal is for the child to share their narrative with their caregiver. So sometimes we see this happen. I've had clients who are in residential care or go into residential care when they're working through TFCBT, or who have engaged in TFCBT in residential care. And sometimes this can happen with a caregiver that they will be returning to once discharged from residential care. But sometimes it happens with a caregiver within the facility. If they have built a strong, close relationship with a caregiver within that facility, then it would be completely appropriate for that caregiver to be part of this joint session. Sorry, I'm playing with my fiddles. Look at this fidget, okay? It's a spinner, and it's a thing. Thank you for being patient with me and allowing me to fiddle with this as we go through our session. It's been a rough week here. So I appreciate your patience and your kindness when you hear this spinny sound going on down here. All right, so I squirrel away. Let me come back. So what then is the role of the parent or caregiver during this verbalization? So this is really important, and this is why it's super important also for clinicians to continue to have communication, confidential communication. We have to remember our confidentiality with our client, but continued communication with the caregiver is that it is imperative that they have practiced, that we, the clinicians, have practiced this with the parent through a role-playing scenario, the child's narrative. Because we have to remember that these traumas that caregivers are going to be exposed to can cause what? What is a trauma? What is it called when you experience trauma because you're in close relationship to someone else's trauma, or you hear about someone else's trauma? What are the terms? There's like two we can use. Secondary trauma, vicarious trauma, right? So when a caregiver is exposed to this child's narrative, and it opens them up for vicarious trauma and secondary trauma. So as we're meeting with the caregiver, what are some important things we need to practice with them or educate them about besides the role play? So let's think about this. What do we do with our own clients when we're going to be reviewing their trauma? We do regulation skills, right? We look at SUDS. We try to do a quick education on how do you know as the caregiver when you're starting to feel your cortisol rise, when you're starting to feel yourself have a reaction. When can you start to recognize that maybe you're starting to come into your amygdala, and what can we do to bring that prefrontal cortex back so that you can remain a support for the client, so that the focus during the narrative stays on the child's narrative and not your emotions tied to the narrative. So review those with the caregiver. What are signs that you're beginning to escalate, right? What are some coping skills that you can implement during a session if need be? And how can you as a clinician also be able to observe these cues and maybe suggest implementation of regulation for not just our client, but also for the caregiver? So we also want to prepare the child for the joint sessions, right? And that again comes into what? Practicing, right? Role playing. So they're going to read the narrative, and then we're going to review any questions the child has for the parent. This time too, we can review with our clients. How do you know when your SUD scale is coming up? What do you feel in your body? How do you feel it in your body? What are some coping skills, relaxation skills, mindfulness techniques we can have ready and prepared so that if you need to utilize them during the session, they are right there? How can I as a clinician assist you to better utilize those? So we're going to do that with our client also. Also, lots and lots of positive reinforcement and praise for both the client and the caregiver for engaging in this very difficult section of TFCBT. So in the 15-minute individual sessions, it is so necessary that we review that material, like I just said, that we prep each participant, and that we assist them with the work that they're needing to do. So how exactly does the joint session line up? So we have that the child reads their narrative. Here we go with the praise. The therapist and the parent praise the child. The child asks their questions. The parent asks their questions, and then they decide future topics. So safety is a huge one, and safety around sexuality, boundaries, all of those things are discussed for future topics. And those can be very particular or specific, for what trauma the client has experienced. And we also have to remember too, was this trauma experienced, was it complex? So was this caregiver who was in there right now in that session, are they directly connected to this trauma? And if so, that needs to be a huge consideration when we're prepping both the child and the caregiver. What kind of questions are going to be asked from this child to this caregiver if this caregiver is directly connected to the trauma? So this is an important part to remember. We are facilitators, right? This is not about us. We are there to facilitate the interaction. And we only intervene if we know it is what needs to be done at that time for the benefit of our client or for the benefit of the caregiver. We are facilitators, right? I really want you all to be able to grasp this understanding that we play a role that is crucial, right? Because we have the tools, we know the tools to assist our clients and to assist our caregivers. But it's not about us. It's really not, right? We have our circle of control. Our clients are autonomous. Their caregivers are autonomous. So this is not about us. It is about our client and their caregiver. So we are there to facilitate. We are there to offer tools. We are there to clarify. We are there to praise and encourage. We are not there to intervene unless it is absolutely necessary. This will take so much off of you as clinicians as far as your own cognitive distortions about how good you are as a clinician. It's so important that we are competent, right? It's one of our ethics as a social worker. But we don't fix people. We give people tools. We assist people, and they choose to fix themselves. They have it within themselves. So some helpful tools: lay out the ground rules, right? Again, back to the very first step of TFCBT. We want to make sure this is a safe place for our client and a safe place for their caregiver. Sometimes some clinicians like to use a very concrete item to signify whose turn it is to talk, such as a talking stick, a stuffed animal, something like that. And then we are also going to make sure we are prepared and speak about, okay, if I need to facilitate in some way, if you see me stand up, if you see me flicker the lights, that's my cue of saying, hey, we need to pause for a minute, or I need to intervene for a second. It is super important that we as clinicians continue to assess through this narrative process so that we can help identify if someone needs to take a break, and that everyone gets a chance to talk, right? Because if we miss a cue that our client or our caregiver's prefrontal cortex, they're flipping that lid, and we are not able to help either the client or the caregiver engage again, then the conversation is lost, right? So we play a very crucial role. Please check out the supplemental worksheets in Module 7 that have some coaching that can assist our caregivers and talks about the effectiveness of TFCBT that we can share with our caregivers. We also have a link here for the importance of the therapeutic relationship. And I've said this, I think, every week, and I will continue to say it because it is absolutely the truth, that the therapeutic relationship, it is the most influential factor in the client's success over any model, over any technique, or over any modality or therapeutic intervention. It is the foundation. And remember, building that therapeutic relationship does not occur in session 1. As far as having it completely built, it's not completely built in session 2, session 3. The therapeutic relationship is an ongoing, fluid component of our modality, of our time with our clients. So please stay encouraged. Take what you know here, take the steps that you know here, and make it yours, and make it your clients, right? Again, I want you all to be authentic clinicians, and that looks different for each individual, but it also looks different for the client that you're working with. So I have my character, right? Not like character as in not who I am, but my character, my personal characteristics, my traits that I use as a clinician, but they do alter slightly depending on the client that I'm working with. Right? So I really appreciate this slide. It talks about independence and healing, and it talks about why it is important, again, for that therapeutic relationship to occur, because we are human beings. And in creating that therapeutic relationship, in creating that connection, that human connection, we as clinicians are play a really important role in creating a safe place and speaking with a safe voice and maintaining safe posture with our clients so that we can mirror a calm presence and that we can provide an environment that assists our clinicians' our clients' prefrontal cortex and being engaged. So that's super important that we are able to do that so that they can strengthen their safety, they can strengthen their attachment, and they can strengthen their regulation. Super important announcement. Don't forget that assignments are due on Friday of this week and not Sunday. That includes your participation activity and your integrative resilience analysis. Again, thank you so much for allowing me to walk with you all along this journey of second semester and second course of TFCBT and trauma-informed care. If you all are graduating this semester, congratulations on finishing grad school. It is a huge, huge accomplishment, and I wish you all just like the life that you need and majority of peace and happiness. So, thank you.